policies that are well-intentioned and well-meant can actually do more harm than good if we're not implementing them based on evidence. The problem now is that often we're not using the research evidence we have to inform important decisions about how to organize and finance, govern our health systems. When you're poor, you actually need more research, not less, because you want to make sure that you're using the few sources you have well.
So there's clearly a financial imperative to doing this.
Yeah, absolutely. Yeah, both, not even more than that, there's the human imperative. People are suffering and dying. There's probably not any one thing or one thing that works everywhere, one way to do this, but that we could learn and get a better sense of what works and what are the contextual factors that determine what works where. The project isn't developing policies for Africa, but it's developing policy for Uganda, policy for Tanzania, policy for Burkina Faso. And each country begins with an analysis of the problem. So each country begins by looking at why aren't people getting ACT, or why aren't people using bed nets appropriately, getting bed nets, why isn't spraying being done where it should be done, residual spraying. Why is there a high rate of maternal mortality right now in Burkina Faso and the Central African Republic? We're not replacing those networks in any way, but it's to support those networks. And so the funding is to help us to develop the tools that will be used by the EVABNet teams and by REACH to do the work that they've already started to do. But the problem is that people who need it aren't getting it, and in particular children and pregnant women who are dying from malaria unnecessarily because it's a treatable disease. So looking at delivery arrangements. So for example, nearly all of the countries that we're working with in Africa don't have sufficient physicians that you could rely on physicians to provide it. So looking at using community health workers and making sure then how do you train them, how do you organize, mobilize the community health workers that most countries already have, so that they get the ACT, they know how to use it, and that they're treating people with ACT. The question is making sure that that money gets where it's needed, and so that the drugs are purchased, they're distributed appropriately, that the money is being used correctly, that it's not being misused, that corruption's addressed where that's a problem. Hopefully we'll have more successes than failures, but that we'll learn both from what works and what doesn't work. It's early days, and I don't think we know yet what's going to work. I think we've got a lot to learn, and that's what we're trying to do.